Afternoon, everyone, and welcome to today's webinar. This is Not Your Mother's Medicare. Um, my name is Elizabeth England, and I'm an HR practitioner and a licensed Medicare sales representative. I want to thank you for joining me today. I'm honored to be here, and I want to thank Wynn Cleveland for this opportunity to share this valuable information with you.
Yeah.
Okay, good. So if you ladies don't mind, I do have a couple questions. I kind of like to know who I'm speaking to, the age ranges for the audience. I know the one young lady said she was on for her mother. You can, well, I guess you can only do one, but if you could just put in what your age is. It's anonymous, nobody will know. Okay, good. That's going well. And then the second poll question is, what's your employment status? All right, because we have a plan for everyone. So that's why I'm asking that question. And then the third question is, are you ready for the holidays? Oh my goodness, look at that. Okay, Yolanda, how many do you think we're ready to close it?
You think you're ready?
How many do you have in? 40, 50?
19, about 80%. Oh, we're almost there, 86.
Okay, let's get to 90%.
Okay.
All righty, 86, I see, 86% voted. 20 out of 23, I think we're good.
Okay.
Yeah, let's close it.
Okay.
Okay, so look like I've got the targeted audience here, the 65 to 74, very good, 40%. The individuals that are 55 to 64, now is the time to start planning. It's never too early to start planning for your retirement. It will go fast. And as far as your employment is concerned, so if you're employed, you probably are on your employer group plan, and I'm going to talk about that, what your options are. Self-employed, definitely we want to let you know about your options for Medicare. And nobody has even gotten ready yet for the holiday. So I think that's par for the course, but Thanksgiving is just a couple weeks away. All right, so thank you all for participating. And I'm having trouble getting it to page down. There we go. So the learning objectives, we're off. And I'm going to apologize in advance. I'm going to be talking pretty fast. If you have any questions, just put them in the chat box, and then Yolanda can stop me if I need to stop. So here are our learning objectives. So my goal is to increase your awareness and knowledge of what Medicare is and what Medicare is not. So I will provide practical information for anyone turning age 65 or anyone currently working and plans to retire after age 65. I will share with you what actions you can take to take full advantage of what's available. Okay, here's the agenda. I'm going to start off talking about today's workforce. It's very pertinent. We'll go over the basics of Medicare. I'll show you some resources where you can go get additional information, and hopefully we'll have time for some questions and answers. Okay, so today's workforce. So my background is human resources. And so, this is something it's always had my eye on. But today, there are currently 5, maybe 6 generations working in the workforce today. So you have your silent generation, which they're called traditionalists, baby boomers, which I'm a baby boomer, Gen X, you have your millennials, Gen Z, and it goes on to centennials and on and on and on. So the millennials, the Gen Ys, they're in their 40s. They overtook the baby boomers last year in 2019. So now they are the largest US population group. Okay, so baby boomers are now the second largest population group. And the baby boomers have had and continues to have a significant impact on the community. So approximately 3 million baby boomers are expected to turn age 65 each year. So that's about 10,000 daily until 2030. So for the next 10 years. The peak is expected in 2022, which is a little over a year from now. So a baby boomer is someone that was born between 1944 and 1964. They are age 56 through 76. There's 76 million baby boomers in the US today. Now, even though they're turning age 65, 10,000 every day, they're not all exiting the workforce. Okay, rather baby boomers are declining at half that rate. So that leaves 5,000 baby boomers in the workforce, and which poses a problem for HR, for succession planning, but this isn't an HR presentation. So according to a 2019 peer review research study, 2/3 of adults age 54 to 64 are still in the labor force. So you ask, well, why? Why don't they just retire? Well, boomers are living longer. They're more educated, they're more active, than the prior generations. Okay. So let's talk about Medicare. So Medicare is all this that's shown in this slide, in this one screenshot. So, everybody just like, Medicare. Well, it kind of is that. So I love this slide. I love this slide. Okay, so what is Medicare? Medicare is a federal insurance program, okay? It's administered by Centers for Medicare and Medicaid Services, CMS. And then CMS is an agency of the Department of Health and Human Services, HSS. And then the Social Security Administration, or the Social Security offices, actually administer Medicare, okay? So they process the applications for Medicare, and they can also provide general information. So you can call Social Security Administration, your local Social Security office, and ask them some questions. And then Medicare is an individual health insurance plan. So, I'm an individual, you're an individual. That's how you sign up for your Medicare benefits. You'll receive a unique Medicare ID number. It used to be your Social Security number, but with identity theft and everything, they changed that. And you'll have a unique Medicare ID number. So what Medicare is not? Medicare is not a family plan, which I just mentioned. It's it's an individual plan, so you can't have dependents on it. It's not Social Security, which consists of retirement, disability, and survivor benefits. It's not Medicaid, which is a federal and state program for low-income individuals and families. And Medicare is not free. Many seniors are shocked to learn that Medicare coverage is in no way free. So we'll get into the cost. I have that for you as well. So who's eligible for Medicare? All right. So if you're age 65 or older, or under age 65 with a permanent disability, such as end-stage renal disease or ALS, you're eligible, all right? So if you're age 65 and older, so you're eligible if you or your spouse worked and paid Social Security taxes for at least 40 years or 10 years. So if you were a housewife and you never went to work, but your husband did, you're eligible for Medicare, all right? You are a permanent resident in the US for at least 5 years in a row, all righty? So that's the eligibility. We talk about benefits, we got to know who's eligible. Now, this is the cover of the 2020 Medicare and You handbook. And I usually, during this time, I usually, get audience participation, make it a little more interactive. And I ask, the people on the webinar, what do you see? What do you see? And so if anybody wants to put some information in the chat box, Yolanda can read them off for us. But in the interest of time, I'm going to keep moving. And then I always get some good ideas from the group too. So anyway, I see older adults. They're smiling. All right. This looks to me like a grandmother, a father and a daughter, father. Here's some professional people, maybe some entrepreneurs like we have on the call today. HR people, accounting people, we don't know, but they're on Medicare. And then we have this one individual that's in a wheelchair, obviously disabled. I don't know if she's over 65 or under 65, but if she met the eligibility rules, then she's eligible for Medicare. So this is what Medicare looks like today. So you know the title of my presentation is "This Isn't Your Mother's Medicare." Okay, so this is what Medicare looked like today. So is this your image of a person on Medicare? Okay, so now we're going to get into the A, B, C, and D of Medicare. All right. So if you went to kindergarten, first grade, you know your ABCs. So there is a method to their madness. You just got to kind of follow along. So Medicare has 4 parts: Parts A, Part B, Part C, Part D. And I'm going to go over each one of those in a little more detail. And then, of course, then here is your Medicare ID card. And you see it has a unique ID number here. That used to be your social security number. Now it's a unique ID number. And it'll have the effective date of when your A and B was effective. Okay. So what Medicare covers. Okay. So Medicare, we already told you it's a federal program. So original Medicare has 2 parts. You have Part A and Part B. And so I'm a very visual person, so this is the only way I can remember this stuff. So original Medicare Part A includes your hospital coverage, inpatient hospital care, home health care, skilled nursing facility, hospice. Now, generally Part A, there's no premium. It's premium free, all right? But there are deductibles and copays, and I'll show you those. And with Part A, original Medicare, you can't be denied coverage. So there's no pre-existing rules that apply or anything. You get Part A automatically. Okay. Part B, however, you do have to sign up for Part B, and there is a premium, but Part B covers physician visits, outpatient services, all your preventative services at 100%, medical equipment, and some home health visits. There is a monthly premium, and it's adjusted for income. And I'm going to show you what that is in a moment. With your Part B, it's a 80-20 plan. So you have a premium, and you have a deductible, and you have co-insurances. And you've probably seen the commercials on the TV where it's a piece of a pie, a Medicare pizza pie, and 80% is what Medicare pay and 20% is what you pay. That's still true. It's an 80-20 plan. But here again, you can't be denied as long as you meet the eligibility requirements. You can't be denied, and you can also pay your monthly premium. You can have it automatically deducted from your Social Security check if you're collecting your Social Security benefits, or you can have it taken out by electronic fund transfer, or you can pay by credit card, or you can pay by check. I'm currently over 65. I am not collecting my Social Security at this time, and I pay, and Social Security bills me every quarter. And so I pay by check every quarter my Medicare Part B premium. Now, there is a penalty for late enrollment. And so when you're eligible to get into the plan, it's advisable that you get in, or else you'll be assessed the late enrollment penalty. Okay, now stop, just wait 1 minute. Take a breath. Medicare, original Medicare does not cover everything, okay? So they have private insurance companies that may cover some things that original Medicare does not cover, such as, you didn't hear me mention anything about prescription drugs in Part A and Part B. So you have no prescription drug coverage with original Medicare. You do not have dental coverage, or eyeglasses, or contacts, or hearing aids, or long-term custodial care, or coverage outside of the United States. So you're like, okay. Well, that's original Medicare. That's the more traditional Medicare. So then you ask the question, well, then how much is all this going to cost me if I decide to go with Medicare? So remember I said for Part A, the premium is generally zero for most people and everything's adjusted for income, all right? And then it does have a deductible. So with your Part A, if you go to the hospital, you're in an accident, you have an accident, you go in the hospital. So there is a $1,400 deductible you have to pay, all right? And that's only for 60 days. So if you go in the hospital for a week and then 60 days later you get hurt again and you go back in, you've got another $1,400 deductible to pay. And so for every day that you're in the hospital, they have a per day limit for these amount of days, and then they have a lifetime max. The thing you need to be aware of for Medicare Part A and Part B, there's no out-of-pocket limit. So there's no financial security or protection against catastrophic claims. Okay, there's no cap. You know, they'll keep paying, but you'll keep paying as well. All right. So here's your Part B premiums. And the best thing about this slide that saves me is that Social Security will tell you the exact amount you will pay for Part B. So most people pay $144.60. I do have a client, she called me, she told me she's paying $289.20. She said she sold some property, so her income went up. So every year they look at your income and it's either going up or down. And so Social Security will tell you the exact amount that you will pay. All right. Now, since we're talking about costs, here's Part D. This is for the drug, because remember I said Part A and B, you don't have drugs. So there's a Part D, and we'll talk about D more. But here, while we're talking about the costs for Medicare Part D prescription drug, the Part D plan premium is what most people will pay. A lot of the Medicare Advantage plans, there is no Part D premium, it's all included. If you make more, you earn more, you're going to pay that Part D premium plus an additional $31.50 for that entire year. Everything's on a calendar year, January through December. We're going through open enrollment right now, which you guys heard me talk about for the last month. But just so you know, and here, definitely you don't want to mess around and don't enroll when you're supposed to, because there is a penalty, and it's a pretty steep penalty, and you always have to pay it as long as you enrolled in Part D. Okay, so breaking news, hot off the press, CMS has announced the 2021 Medicare Parts A and B premiums and deductibles. Okay, now this might look bad, but this is actually good because they're expecting an increase in cost in 2021 due to COVID-19. And they were looking at some really high numbers, but they were nice to us and they're not going all out. So the Part A, which I told you, is generally zero, all right? Your Part A deductible, remember you go in the hospital for 60 days, less than 60 days or every 60 days. So that went up to $1,484, a $76 per month increase. And so that's a 5.4% increase for my math people. Part B, your monthly premium went from $144.60. Come January 1st, it's going to be $148.50, $3.90 increase, dollar increase, 2.7%. And then your Part B deductible, which is $198 right now, is going up to $203, $5 increase, 2.5% increase. So I want to make a note here. If you're currently collecting Social Security, they recently received a 1.3% cost of living increase. Well, that just got eaten up already. I mean, you know, why? So just so you know. Okay, so we've talked about Part A, Part B, and actually D. but where can I get more coverage? All right, Part A and original Medicare is just not going to make work for me. I need more coverage. So where am I going to get more coverage? Well, the first thing you can do is purchase a Medicare supplement insurance plan. You probably know them more by a Medigap. United Healthcare is like the best known. They've been in the business for like 40 years. But a Medigap plan helps cover what Medicare Part A and Part B do not. Remember, I showed you a list of things that original Medicare doesn't cover? Well, these private insurance companies, and they're regulated by state, they offer a standardized Medicare supplement insurance plan, and it's standardized by the government, and it can't be used with a Medicare Advantage plan. There's no provider network, so you can go see any doctor in the United States. And so with Medicare, original Medicare, the vast majorities of doctors in the country takes this insurance. And so when you get a Medigap plan, then the majority of doctors are going to take that insurance as well. So approximately 93% of all doctors accept Medicare. So, Medicare is a good thing. You have access to the doctors. There's no provider network. That's why a lot of people like this plan. They don't want to have to go to the doctor. And the other aspect of this, though, is that you do have to purchase a standalone prescription drug plan if you want drug coverage. So everything is optional, I guess I should say. So real quick, this is a Medicare sub plan comparison. So there are 10 plans. Each state can offer all 10 or one or two of them. I think they all have to offer A, and then they can pick and choose which other ones they want. Plan F was the most popular, or is the most popular, because you see it pays 100% of everything. These are the covered benefits, okay? So your hospital co-insurance, your deductible, those kind of things. Plan F covers everything, and 80% for foreign travel. That's another reason why a lot of people like this plan. But see my little asterisk here, which I don't have up here, shame on me. But as of January 1st, only individuals eligible for Medicare prior to 1/1 can purchase the F plan. So I was 65 before January 2020. I can actually purchase this F plan if I wanted it. So anybody that turned 65 after 1/1, they can't get this plan anymore. All right. And it's grandfathered, people that are in it to stay. So G is the next one. A lot of people are looking at the G plan. So these MedSup plans is based on your age, and it goes up maybe every year. They are a little pricey, but you pay for convenience. You pay for what you want to pay for. No one can tell you what you want or how you want to handle it. If you this is probably a good plan to look to see if your parents currently have this plan, because they may be paying too much for this plan and not getting the value out of it. A lot of people are overinsured. They got a plan, they're not using it. So, if you're working with anyone older, you might want to look to see if they have this plan and if it might be an option to review their other options. And one of their other options would be Part C, A, B, C. And the Part C plans are Medicare Advantage plans. They are new on the market. They are offered by private companies that contracts with Medicare to provide your Part A and Part B benefits. So you get, A and B already bundled in there, okay? Plus, it's generally a Part C plan, generally includes your Part D. It's all bundled into one. And so you still have Medicare. Medicare, you'll always have Medicare. They got your back. Original Medicare got your back. If anything should happen, you don't like any of this stuff, any of these plans, you can always just go back to original Medicare. All right. So the Part C plans, they're called Medicare Advantage plans. You've probably seen a lot of those commercials too, where you can get them for a zero copay, or zero premium, zero copay. Some of that is true. Some of it you may not qualify for, but you know, that's an individual thing you have to look at. So the Part C plan offers additional benefits not provided by original Medicare. Okay, just like your group plan. So we're used to group plans. You got medical, dental, vision, hearing, those kind of things. Well, original Medicare does not. But with this Part C plan, you can get those additional benefits plus a gym membership. Silver sneakers is very popular. They also have over-the-counter catalogs where you can purchase items that you would normally go to the drugstore for. You get an allowance, $100 a quarter allowance to purchase, you know, Band-Aids, alcohol, toothpaste, grab bars, canes, all kinds of stuff. Very, very, very nice benefit. And the Part C plans are administered by the carrier, the plan administrator. So if you sign up with a medical mutual plan, you're going to get a medical mutual Medicare Advantage ID card. And so when you go see your doctor or the pharmacist, you give them that card and you put your red, white, and blue card someplace safe. You won't have to use it. Okay. So to me, this is the most important slide. Like I told you, I'm a very visual person. And so this kind of sums it up. So options for more coverage. Okay. You have option 1, you have option 2. You already have original Medicare. It was like 55 years ago it was started. So you can add on to that. So here you can do what we call a la carte. So you can add a Medicare supplement insurance plan, and it'll help pay for some of your Medicare out-of-pocket costs, but you have a separate premium for that and your Part B premium. And then more than likely, you're going to want a drug coverage. So you can purchase a standalone drug plan and you have another separate premium for that as well. Or you can go to the buffet and get a Medicare Advantage plan. Everything's all in one. It's all bundled. One ID card, one premium, all these extra benefits. So it combines Parts A and Parts B. They're usually, well, they are. It's either an HMO or PPO. Okay. More than likely, your doctor is in an HMO or a PPO. So that's one of the things we look at when we look at you enrolling in a Medicare Part C plan. Okay, that and other things. But it usually includes your prescription drug coverage as well, and offers additional benefits, your dental, your vision, your gym membership. And I'm so mad I have silver sneakers now and I can't go to the gym, you know? So, I mean, that's what, $50 a month, and that's going to be part of the monthly premium, which is $0. I mean, can't beat that with a stick. So which coverage is best for me? Good question. It depends. Ha. So I call it the 3 C's. You have to look at the cost, the coverage, and the convenience. Okay. I stole that from when I was buying a diamond. I think you look for clarity, cut, something or another. If anybody knows what those 3 things in, type it in there for me. It's been driving me crazy. So the 3 C's. So with a Medicare Advantage plan, when you're trying to decide which plan is best for you, we're all an individual, remember? So the 3 C's, the cost. So this is a comparison, a Medicare Advantage, Medicare sub plan, Medigap. If you look at the cost, with a Medicare Advantage plan, low monthly premium, many as low as $0. It's true. But they're getting part of your Part B premium. So nothing in life is free. So you must continue to pay your Part B premium. But I'll take a 0 premium plan any day. Next, for the Medicare Medigap plan, higher premiums. So you have lower out-of-pocket costs, if any. If you get that plan up, it's paying 100% of everything. But you still got to continue paying your Part B premium. So you've got your Med Sup premium and you got your Part B premium. The coverage, so with the Medicare Part C plan, you may have to use a network doctor. Well, you do have to use a network doctor, except for in case of an emergency or an urgent situation. And you may have to get a referral to a specialist. With the Medigap plan, you can see any doctor, go to any hospital that accepts Medicare, and 93% of doctors and hospitals accept Medicare. And then the third thing is convenience, okay? Well, we probably should say about the drug plan too. Well, I guess that's here in the one card. Okay, so the Medicare Advantage plan, you carry one card, which is the plan administrator, which is Anthem, Aetna, United Healthcare, whoever. Those are your plan administrators. You carry one card. With this Medicare Medigap plan, you're carrying your red, white, and blue card. You're carrying a Medigap card, and you're going to carry a Part D card. So cost, convenience, and coverage. So like I said, it all depends. The decision all depends on your health status, the cost, the coverage, the convenience, whether or not your doctors are in the network. So, we research all that before, we have you sign up for a plan, and we make sure that you're comfortable and it meets your needs. We do a needs assessment. Okay. So if you're a benefits geek guru like I am, we're always comparing last year's plan with this year's plan, and then, planning for next year's plan. So remember I said this isn't your mother's Medicare? Well, look at these highlights. So just over the last 3 years, there's been a 34% decrease in the average monthly premiums for Medicare Advantage plans. Okay, and that's why you're seeing all these zero premium plans. Some plans have 2 zero premium plans. They made the second one even better than the last one. Okay, so there are over 4,800 Medicare Advantage plans that are offered for 2021. Compared to 3 years ago, there were 2,700. So these insurance companies are doing something right. They're making money. They got, 10,000 people turning 65 every day. I'm sure they want a piece of that pie. And then your Medicare Part D plans, they're more available. And the basic Part D premiums have dropped 12%. So you need to take a look. One of the common mistakes is people think they can't afford Medicare. Well, this is something that you need to do. You need to take a look and see. I'm going to hit admit on that guy. So one other thing I'm really excited about is that they launched or announced a Medicare Part D senior savings prescription drug plan. You might have heard about that. You know what? I think Yolanda might be away. Oh, nope. I don't want to do that. Let's get out of that. Okay. Part D senior savings prescription plan, drug plan. This is new. And people on insulin are really, really happy because insulin is very expensive. So the maximum copay is $35 for a 30-day supply. All right. So equals a savings of about $446 a year out of pocket for the cost of insulin. Now, insulin is something you can't go without. It's not like, oh, I can take half a pill or I'll just go every other day. No, when you have to take your insulin, you're talking life or death. So you have, they can get a savings of $446 out of their out-of-pocket costs. That's huge. And what's even better is the insurance companies jumped right on this. I'm thinking, they're not going to want to do that. Look, more than 1,600 Medicare Advantage plans and prescription Part D plans are participating in the program. So kudos to those guys. We know, we say they're making money. I never feel sorry for insurance companies. But anyway, this is what's happening for 2021. And that's why we're going through open enrollment right now. Okay, so let's see. Come on, page down. What happened? Come on. There we go. So let's talk about Part D real quick. I see I got about 10 minutes left and I'm almost done. And I'll just kind of whiz through. So Part D is your drug Part D plan. It's fairly new also. But on average, Medicare members take 4.2 to 4.7 prescription Medications per month, I think it's higher than that, but there's millions of Medicare enrollees, beneficiaries. Baby boomers have 5 or more chronic conditions. So that means you're taking a maintenance medication and want something every day. And you say, well, what's a chronic condition? High blood pressure, diabetes, heart disease. Those are chronic conditions. So, baby boomers are taking medications. So the Part D plan is available with all your Part A and Part B, and it can be purchased through a private insurance company. I like to point out that you can just do a Part A and a Part D, and so you don't have to pay a Part B premium, so you won't get medical. You'll have hospital and drugs. So they come in standalones. There is a formulary, just like your current employer plan, your group plan. It's a formulary, which is nothing more than a drug list, a list of medications that are covered in the formulary. All the pharmacies participate. They say network pharmacies because you can get preferred pricing if you go to a network pharmacy like a CVS or Walgreens. Other than that, you get standard pricing, which isn't that much difference. In some cases, it makes a difference. I shouldn't say that. But your Part D plans, they have a premium, copays, and deductibles, depends on the plan. And you don't want to go more than 63 days without prescription drug coverage, or you will be assessed a late enrollment penalty. It's pretty steep. It's like 1% for every month that you missed. Real quick, Part D, this is just to show you it goes through stages. So just like your medical plan, you have your annual deductible, and then you get into the initial stage, and then everybody knows about the donut hole, and then you go into catastrophic coverage. This changes every year. A lot of people never reach the coverage gap. Some plans don't have a deductible. These amounts have changed this year too, and I didn't record those, but they changed. Okay, so when can you enroll? All right, coming around the corner here. So turning 65. Well, happy birthday to you. What a milestone in your life. Somebody recently said they can't wait to turn 65. I couldn't wait to turn 65. But one thing that catches some 65-year-olds by surprise is that Medicare won't necessarily sign you up automatically. But I'm going to give you a clue. 3 months before your birthday, you're going to start receiving all kinds of information from the insurance companies. They want you to sign up with them. So you'll need to do that on your own. However, if you're currently collecting your Social Security benefits, they will enroll you automatically. And then if you don't want it, then you got to go contact them and tell them you want to opt out. I did a lot of those yesterday. People that didn't want to do Part B right now. So in order to avoid any gaps in your coverage, they have what's known as your initial enrollment period. Okay, it's a total of 7 months. Okay, so it's 3 months before your birthday. That's when you're going to start getting all that mail in the mail, all those brochures in the mail, and then your birthday month, and then your the 3 months after your birthday. So your everything's on the first of the month. So if you're born in February, your Medicare is effective February 1st. Okay. So it took me 3 months to figure out which plan I wanted, and I'm in benefits, but I looked at everything, but I figured it out. So I can help you figure yours out as well. I do recommend that you go ahead and apply for your Social Security account. Go to ssa.gov, sign up for your Social Security account, which will show you, what your earnings were. You remember how they used to send out that letter that showed you your earnings over the years? So this is where you can sign up for that account, and you'll actually go to your Social Security account to sign up for Medicare. That's why people are so confused. But so even if you're not ready to retire, I recommend you go ahead and sign up for your Social Security account. It's called My SSA. And just so you know, turning 65, so if you're still working, turning 65 is a qualifying event. You get married, you get divorced, you have a baby, qualifying event. I don't repeat that. I didn't repeat that when I was doing benefits because they would look at me like I'm crazy. Turn 65. I just started here today. So it is a qualifying event, and you can go ahead and enroll in Medicare even if you're still working. Okay, let's keep going here. If you're interested in a Medicare sub plan, you want to get in it the first 6 months when you turn 65 or enroll in Part B, because there's no underwriting, okay? If you wait, you will be subject to medical underwriting and you may be denied or charged more. Here's the late enrollment penalties. We're not going to talk about those. Okay, so if you're still working, you're eligible for a special enrollment period. It's an SEP. What's important here, though, is that you don't let those 63 days lapse before you enroll in your Part D. If you're not going to do C or D, then you got 8 months, all right? One quick note about COBRA and retiree health coverage. They don't count as creditable coverage. So your company comes and say, you know, unfortunately, your position's been eliminated. We're going to give you 6 months of COBRA. You're 65 years old. You can't take that COBRA because COBRA is not considered creditable coverage. So just a word of warning on that one. If you're participating in an HSA savings account, you have to, and you're 65, working past 65, you have to start contributing 6 months before. You can obviously withdraw the money out of that account for your Medicare expenses, but you can't contribute anymore. This is just a chart that says if you work for an employer with less than 20 employees, you have to sign up for Medicare. If you work at an employer with more than 20 employees, you have an option. This is a real quick example. If you want, I always tell my clients, I used to tell my employees, you got to do the math. They go, Liz, which plan should I take? I don't know. You got to do the math. You got to figure out how much you're paying every year for different services. But since this is not your mother's Medicare anymore, you might want to go ahead and do the Medicare, continue to work, get on a Medicare plan, especially if you're single or if your spouse has other coverage. Same thing with the drug plan. So we're in Medicare enrollment right now, annual enrollment. This happens every year. So just like your group plan, January through December, you have November, October annual enrollment. We're doing it right now. You can switch from A to B. You can switch back to original Medicare. You can switch your prescription drug plan. It's open enrollment. You can do, you can make changes. And I highly, highly recommend that you do this every year because the new plans that are coming out are mind-boggling. I know people, oh, well, I'm happy with my plan. I'm okay. It's zero premium. Yeah, well, they got a better zero premium plan. And I mean, it doesn't cost you anything. I don't charge anything. All the reviews are free, no cost, no obligation. So I highly recommend that you get that review. And so does CMS. Highly recommend you get that review done every day, every year. I got 3 minutes and I'm going to click and just show you where you can go and get more information. So everything I just talked about is out here. This is Medicare.gov. This is where I used to tell my employees to go when I didn't know anything. Go to Medicare.gov. So you can see everything, you can get forms. It talks about everything I just talked about. All right. Be careful about signing up though, but you can sign up on your own. You don't have to have an agent. Okay. Here's the Social Security Administration account. Tons of great information. Here's what I want you to do. I want you to sign up for my Social Security account. That's your homework for today. Get that done if you haven't done it already. And as you notice, this is where you're going to come sign up for Medicare. All righty. And the last thing is the State Health Insurance Assistance Program. Let's see, shift. There we go. Great plan for you, so you can get local help and information. I use it a lot for my clients to find their local Social Security office. They're all closed, but you can call them and they'll help you. But if you have more questions about the Medigap plan or just anything, if you're eligible for other assistance, this is a good place to go. So with that being said, I'm going to thank you for your time. I hope I didn't go too fast. Here is my contact information. It's in the chat box as well, so save the chat. And if there's any questions, I mean, I can stay. I have 12:59. Yolanda, what are we doing?